Hey guys, it's Zaner from It's Your Birth. Today I wanted to chat about the differences between how the media and movies portray birth and what birth can actually look like. So if I were to ask you in the last 15 years, any movie or TV show that you have watched that involved somebody birthing a baby, think about what that looked like, right? Or even some of the reality TV shows that were on for a while too. Birth was dramatic and loud, and women were screaming, and dads were passing out, and there was always this emergency right around the corner. That is kind of the belief system or the culture that we've all grown up in to expect birth to be. Women are always laying flat on their back with their feet in stirrups. They're always in a hospital gown. There's providers around them. Everybody's wearing full masks and eye protective gear. And that is the visualization that women have been seeing and men have been seeing since they've been little children. That's where I believe a lot of the fear comes from around childbirth. We've never been able to witness what birth can actually be. As a home birth midwife, I get to be in a very sacred space for a lot of families where I get to bear witness to their sacred moment of a new human joining us earthside. And it's not that birth isn't hard or hard work or even painful. Like, women do work hard to birth their babies. But when you can bear witness to the normal physiology, and when women are allowed to experience that physiology and the natural hormones of birth, it's a completely different visualization. Right now, we are so lucky living in this technological age of social media and YouTube videos. So many women are willing to share their birthing experiences online. So women of today having their babies have this unique opportunity to start being able to witness what birth can be like. And yes, there still are those dramatic births and very medicalized births, and there is a lot of trauma that women are having to process all around the world. One of the benefits of seeing the different contrast is you get to learn what are my options. And when you see different options, or you learn about them, or you visually see birth happening, you can feel in your intuition, that's what I want for my birth. And if this woman can do it, maybe I can too. And that is the seed that's being planted that hopefully women are able to then start researching options, asking questions, talking to other friends, going to support circles, going to online forums, and just figuring out, how can I improve my chances of this being my reality for birthing my baby? So the kinds of images that I see as a home birth midwife when I am present at a birth is I see women and their partners well prepared for birth. They have educated themselves prior to the process. And sure, they probably have some fear going into that, because fear is a normal human emotion. But they also come in with confidence because, again, they've done their homework, they've done their research, they've learned how the body works, they've learned about hormones and physiology. And then they have chosen a supportive birthing team that also believes that birth is normal. So the things that I'm seeing are women moving in a rhythmic way as they're having their contractions, maybe using some vocalizations to help themselves get through. And it's over a period of time where the labor gradually gets stronger and stronger and stronger that brings us to that peak of birth. But the great thing about natural labor is that the surges or the contractions are hills and valleys. So we get breaks in between those contractions. So within that 60 seconds of a contraction, it kind of revs up and you feel it coming on, and then it peaks at the top. That's where the mom has maybe the most challenging time, where she's maybe pushed to her boundary for this short time frame, and then the contraction starts to fade away, and then she gets a break and she doesn't feel anything in between those contractions. And then she does that over a period of time. When the body is working over a period of time, now the orchestration of the hormones start kicking in. So when moms get to be around 6 or 7 centimeters, they start to go internally into their bodies, and they just ride the sensations that they're feeling. They're not in their head anymore. They're not in their head chatter. They're not worried about what's happening around them and is everybody okay and is everybody comfortable. They're just inside and they're coping, and they almost go to this other worldly plane. We call it labor land when we're talking about birth, and they just roll with it. And then eventually comes the time where they start getting the sensations to push their babies out, and they have the freedom of movement. They move where their body tells them to go. They're an active participant in their birth. Most moms are delivering in an upright position, in hands and knees, or in a squat or a kneeling position, and they spontaneously push their babies out without somebody telling them how to do it or how long they should be pushing. Of course, we oftentimes give gentle guidance, especially to a first-time mom. But again, every home birth is personalized and every woman has different needs. So some moms might want a lot of verbal reassurance. Some moms might want a lot of physical touch. Some moms want to go into a private room or a bathroom or a dark bedroom and just be by themselves. And it looks different for everybody. But there's definitely not the whole hysteria, drama, emergencies happening, and everybody's peaceful, centered, calm. And when the baby is born, oftentimes babies are peacefully transitioning. They may give some cries to help clear their lungs, but overall, they're very peaceful, they're very alert, they're where nature intended them to be, which is in their mother's arms. That's a gentle transition for them. They're still getting their cord blood. As they transition to breathing air for the first time, that placenta is still giving them oxygen and all the nutrients and stem cells that they need, that nature intended them to have. So I'm super grateful to all of my clients who have volunteered and offered to share their photos. Some of them have shared their birthing videos. Some of them have hired professional photographers that put together these beautiful tributes to the sacred moment of a new human joining us and a family growing into something that it hadn't been before that. So I hope this video was helpful in talking about the contrast of what we've been led to believe birth is, but what birth actually is and what birth could be for you. Make sure to like and subscribe. If you have any topics that you would like to hear me make a future video about, drop those down in the comments, and make sure to follow me on Instagram and Facebook at It's Your Birth. Until next time.